we go. No, I can't start yet. 12:59. Maybe. Supposed to be. Folks are late, but I don't want to. You're here, so I'm gonna start. Okay, great. Okay. Oh, I'm on. Whoa, yeah. Okay, good afternoon. I'd like to call this meeting to order. Today is Monday, June 16th, 2025. The time is 1 p.m. This is an additional meeting of the Committee on Health, and we're holding this as a hybrid format in room 123 of John A. Wilson Building. I'm at-large Councilmember Christina Henderson, Chair of the Committee. We've been joined by Councilmember Wendell Felder, Ward 7, and Chairman Mendelson. And we have a quorum of the committee. Today, we'll consider and vote on several measures to the Board of Rehabilitative Therapies. The Board of Rehabilitative Therapies was created by DC Law 25-191, the Health Occupation Revision General Amendment Act of 2024, and includes the scopes of 3 boards that were sunset by this law. So, the Board of Physical Therapy, the Board of Occupational Therapy, and the Board of Audiology and Speech Pathology. Those boards will cease to operate upon the creation of the Board of Rehabilitative Therapies, which is set to start on July 19th, 2025, or whenever the majority of the seats are filled, whichever comes first. The Board of Rehabilitative Therapies is comprised of 11 members, appointed by the mayor, 3 physical therapists or physical therapy assistants, licensed in the district, 2 occupational therapies or occupational therapist assistants, 2 audiologists or speech language pathologists licensed, and 1 recreational therapist licensed in the district, as well as 2 consumer members. 1 is licensed as a flexible seat. The first 3 nominees are first-time nominees, and they appeared before the committee on June 2nd, 2025 for the roundtable. PR 26-193 nominates Dr. Bernardine Evans to the board as a physical therapist licensed in the district for a term to serve 2 years. Dr. Evans, who previously served on the Board of Physical Therapy, is a clinical assistant professor of radiation therapy at Howard University and holds a doctor of physical therapy from Syracuse University. She previously directed restorative and rehabilitative services at Ashbury Methodist Village, overseeing a 2,000 resident community and 250-bed rehab facility. She serves on the editorial board of the Journal for Orthopedic Research and Psychotherapy, and is a member of the American Physical Therapy Association and the DC chapter of the American Geriatric Society. Dr. Evans is a Ward 4 resident. PR 24-194 nominates Dr. Angela Grice to the board as a speech language pathologist licensed in the district for a term to serve 3 years. Dr. Grice is the owner of Dialogue Group and an adjunct clinical professor at Howard University. She earned her master's and doctorate degree in speech language pathology from Howard, and her clinical and research focus is on traumatic brain injury, executive functioning, and service delivery among culturally and linguistically diverse populations. She has extensive experience providing speech language services at school, clinical, and rehabilitation settings, and has taught and conducted research at both Howard and Columbia University. Dr. Grice is also a Ward 4 resident. PR 26-199 nominates Dr. Gillian Ray to the board as an occupational therapist licensed in the district for a term to serve 2 years. Dr. Ray is the founder of Sublime Kids LLC and a part-time faculty member of George Washington University's Milken Institute School of Public Health. She brings over 22 years of clinical and academic experience to occupational therapy. Her work spans pediatric and adult care and interdisciplinary collaboration in underserved communities. Her research interests include occupational justice, the impact of adversity on child development, and child and family-centered care. She holds a doctorate in occupational therapy from Temple, and she is a Ward 3 resident. The following 4 nominees previously served on health licensing boards that are now sunset, and they're nominated for this new board. PR 26-192 nominates Dr. Charles Barnes, not Dr. Mr. Charles Barnes, as a recreational therapist licensed in the district to serve a term of 2 years. He previously served on the Board of Occupational Therapy and has over 4 decades of experience in therapeutic recreation, serving seniors, vulnerable populations, and across various care settings. Mr. Bond is a Ward 1 resident, and we have already previously approved him. PR 26-195 nominates Dr. Nicholas Caylor to the board as a physical therapist licensed in the district for a term to turn 3 years. He had previously served on the Board of Physical Therapy and is the lead physical therapist and medical surgical rehabilitation supervisor at George Washington Hospital. It's not George Washington. Nope. George Washington University Hospital, where he oversees over 80 staff members. Dr. Caylor is a Ward 5 resident. 26-197 nominates Omololu uh, Majekodunmi to the board as occupational therapist licensed in the district for a term to serve 3 years. Was previously appointed to the board of occupational therapy and is the CEO of Triumph Therapeutics, where he leads a multidisciplinary team providing outpatient therapy services. He is a Ward 5 resident. And PR 26-198 nominates Rayan Hagona-Wordie to the board as a physical therapist um, for a term to serve 2 years. Ms. Hagona-Wordie previously served on the board of physical therapy and is a home care physical therapist for ASAP DC, as well as the founder of JAW Therapy. And she's also a contracted physical therapist for the Department of Corrections. She is a Ward 7 resident. I'm now going to open the floor for any discussion on these nominees. All right, great. Hearing none, I want to move the draft reports and prints in block. Hold on. These are all wrong numbers, so hang on. For PR 26-193, 194, 199, 192, 195, 197, and 198 for leave for staff to make any technical changes. All in favor, please say aye.
Aye.
Aye. Great. Let the record reflect that the ayes have it and it passes unanimously. This concludes today's committee meeting. The next meeting before the committee will be on Monday, June 23rd. We'll mark up the FY26 Committee on Health budget. No further business before the committee. The time is 1:00.